If you are 25 to 74 years old and due for cervical screening, you have two choices. You can collect your own sample, or your healthcare provider, usually a doctor or a nurse, can collect your sample. Both choices are accurate and safe. At your appointment, it is important to tell your healthcare provider if you have unusual vaginal bleeding, discharge, or pain during sex, since this may change which option is better for you. If you choose to collect your own sample, talk to your healthcare provider. They will give you a special swab to use and explain what to do. You can collect your sample in private, for example, behind a curtain or in a bathroom, or talk to your healthcare provider about other options. To do the test, you will hold the swab by its handle and insert it a few centimeters into your vagina. Rotate the swab for 10 to 30 seconds. Since this is a sample from your vagina, there is no need to reach your cervix with the swab. Put the swab in its packaging and return it. You can also ask your healthcare provider for help in collecting your sample. Your sample will be sent away to be tested for the human papillomavirus, or HPV, but it can't be tested for cell changes. If HPV is found, you will be asked to return so your healthcare provider or a specialist can collect a sample from your cervix to test for cell changes. If you choose for your healthcare provider to collect your sample, they will ask you to remove the clothes on the lower half of your body and lie on an examination bed. You will be covered with a sheet. The healthcare provider will insert a speculum into your vagina and use a small plastic tool to gently brush your cervix. This may feel uncomfortable, but it should not hurt. Tell them if it does. This type of sample can be tested for human papillomavirus, or HPV. If HPV is found, the same sample can also be tested for cell changes. Whichever option you choose, talk to your healthcare provider about how and when you will get your results and any next steps.